DJS Research has conducted research on behalf of the North East London Integrated Care Board in partnership with Haven House and Richard House Children's Hospice to understand any unmet care needs for babies, children and young people across North East London with life-limiting or life-threatening conditions. Deaths in childhood are thankfully rare and decreasing over time. Half of child deaths in England and Wales are children with a life-limiting or life-threatening condition, and the vast majority of these deaths are amongst neonates. While deaths are reducing, the rates of children with a life-limiting or threatening condition is rising in London. While it is good news that advances in healthcare have enabled these children to live much longer, they are often living with highly complex health and care needs, resulting in families having to perform very advanced nursing tasks at home to care for their child. Evidence suggests that children who access palliative care services have less intensive care at the end of their life, and evidence from families in this research also suggests that families who are able to make good use of palliative care services tend to have better care and end-of-life experiences. Although young babies are surviving much longer, there has not been a proportionate amount of uptake and referrals of these babies into palliative care services. There was anecdotal evidence from case studies shared by professionals that families from South East Asian backgrounds may be underserved at present, with white British families reported to have better experiences of their child's end-of-life care. These differences in end-of-life experiences indicate a need for more focused work to audit the end-of-life experience for underserved populations and make efforts to better understand and cater to the needs of the diverse community of North East London. There are misconceptions and negative connotations associated with palliative care, specifically around hospices. These views can make professionals reluctant to recommend services and results in more families being likely to reject palliative care support. Families can also struggle to fully absorb information given to them at a time where they are in heightened states of stress or emotion. As a result, a number of families appear to access palliative care services much further down the line, often after struggling to cope for some time. Experiences of using palliative care services, particularly hospices, were generally very positive. Families get the most out of services when they are able to build up a strong and trusted bond with staff, allowing them to get some much-needed respite. Experiences of palliative care services appears dependent on having consistent, well-trained, knowledgeable staff available to families. Parents note how much they appreciated opportunities to socialise with other parents in a similar situation to them, assuring them that they are not going through this often very isolating experience alone. In addition, parents with a child nearing the age of 18 felt the abrupt removal of these services. To go from benefiting from the children's services available to receiving no replicable support in adult services was a distressing prospect for parents. So while the experiences of paediatric palliative care services are positive, there is more work needed to better signpost and encourage families to accept the support at the right time, particularly for neonates. Families need a trusted single point of contact to help them navigate the system and get the help they need. Services also need to be well resourced enough to provide families with a choice of consistent care no matter what day of the week it is. And throughout a child or young person's palliative care journey, no matter how short or long that journey may be. To access the full report for this research, please follow the link from this QR code.